let's get back to your DrPH. So you're in your DrPH, you have a graduate research assistant at Roe Incorporated, and then you also have a position as a research assistant and a graduate research assistant at UNC Chapel Hill. Walk us through maybe a little bit about those experiences.
Yes. So during your program, your doctoral program, I forget, probably master's programs too, you can, as a form of financial aid, you can work in a research assistantship. And this tells you how bad I am with finances. But the idea is like a grant will pay your salary. And then you also get to put it on your resume or your CV, your curriculum vitae, for the work that you've done. So is what's known as a CRO, sometimes called a CRO, a contract research organization or clinical research organization. It's a very common type of company in pharma and biotech. Essentially, if you have a drug or intervention you want to test, or you want to run a study to survey providers, people out there, and you don't have the resources in your company to do it, you go to a CRO who will help you do anything from designing the study to running the analysis to managing the data, everything under that umbrella. So that's what CROs do, and that's what Roe did. So that position was a very natural fit from my previous role. I was doing the same kind of work. It's just that before I was at one pharma company, whereas a CRO is a service provider to many different companies. Okay, so that was that position. I then switched into a survey sampling role, actually, at UNC. It's like when you look through this timeline, once you realize I have ADHD, it's like, yes, it makes perfect sense. It's not one thing. So survey sampling, I love that experience. It's not my main line of interest, but it was just fun to work on something very different. The funny timing today, Omari, is I just talked to a new colleague this morning, and they were talking to me about surveys. So I brought out this report that I wrote for that group at Chapel Hill. For 1 year, I was put in charge of a project we had with the North Carolina Department of Transportation to do a survey project with them. And I was put in charge. I'm very proud of this report. Hopefully they still use it. But I told my colleague this morning, yo, this is like the first time in 10, 15 years or more that I've shown this to somebody. So nobody's like, hey man, show me your survey sample. Sweet, I got it right here. Yeah. So anyways, now twice in one day. In statistics, I think that's a Dirichlet process, something like that. Anyways, okay, so that was that really fun side project. I think part of the reason that I got interested was the person I'd mentioned before, this fella, Suchi, who was the graduate admissions director. I learned some survey stuff from him. He taught demographics, so not directly, but I think that was probably my connection to it. Cut to my last role at UNC. It was with the Carolina Population Center, and I was in that role for the rest of my time. And so there, I worked on an international study based out of Malawi. It was a study on maternal and child health. The study that I worked on was a sub-study of the big one. The main study was looking at the impact of dietary supplements on infants, on newborns, and to see if like one supplement helped them grow faster than the other, or helped them grow more than the other supplement. It was also paired with another intervention. It was like a 2x2 type intervention. But the main endpoints had to do with preventing HIV infection from the mother to the child and looking at how well the child grows. So anyways, that on a very self-serving note, that study was the data set I worked with for my dissertation. So that's how I got involved with it. Little did I know that through that work, I would meet the person who is now my wonderful spouse. So there you go. Yeah. So that's the work I did there. So those are my three roles at UNC Chapel Hill: pharma, biotech, survey, design and sampling, and public health, RCT intervention, global health. Yeah.
Well, thank you for showing me your report, your survey development report. It was appreciated. I definitely think it is a great day when you're able to show that twice to people, and I think you said a decade or so. So I will take that. I will take that.
It's statistically significant. That it fulfills that criterion. Yeah.
It absolutely does. But I also like the part of like, you're doing this work, but you're also piquing your interest and doing things that pique your interest that mightn't be directly related to what you're doing. And from that, you never know what comes from it, the data for your dissertation, etc.